Hey everybody, this is Alex with Care Conscious, and today we're talking about the costs, the financial element associated with long-term care, specifically residential options. And I'm here with Dr. Ann Glass. She is with the Institute of Gerontology at University of Georgia. And let's just dive right in. I think a lot of people underestimate just how much it's going to cost to pay for long-term care. And I think a common option people think about is nursing homes. Can you give me an idea of what that's going to cost and why it's something we need to think about now?
Well, it costs a lot, is the bottom line, and probably it could be $75,000 a year that we're talking about, and that could go up or down depending on the nursing home you're talking about. But you can see that's a significant amount of money for anybody in any amount of savings. And you're right, people do tend to underestimate how much money they need for savings for retirement and for long-term care.
Right. Just another option, assisted living.
That would probably be about half the cost, maybe $36,000 a year currently.
And for those who want to age in place, what are the costs there?
You could have an aide come in, you might be paying $18 or $20 an hour for that.
So if you do the math, it's not cheap, and it's a big deal. And I think a lot of people think that Medicare is going to cover these costs.
Yeah, and that's just wrong. So
Not
you
true.
need to understand that Medicare, you can't count on Medicare to pay for your long-term care. It's only under very limited circumstances, if you have a designated skilled care need, that Medicare will cover those costs. And they will cover them at home too in that situation, so you can get home health care paid for by Medicare, but it's only a very limited time period. And what most people really end up needing is just the basic help with their activities of daily living, like the bathing and dressing and so forth. Right. And that Medicare doesn't cover at all. So it's only, if you get into that situation, then you're going to have to pay for it out of your pocket.
Out of pocket.
And you can imagine if you're paying $75,000 a year, that's going to go pretty fast.
Right.
And so what happens then is you would, what they call spend down, till you got to meet the low income criteria associated with Medicaid.
Right.
And that varies from state to state, but Medicaid has actually become the primary payer for long-term care. So we're lucky to have it. And some people, might start out as at low income and be eligible for Medicaid right off the bat, but other people will have to spend down to get there.
Right. Are there people who get kind of stuck in the middle, say middle class folks, who don't entirely spend down, and Medicare is not covering everything they need? Where do they turn? What do they do?
Well, they will just have to pay out of the pocket. It could be, in some cases, even if you're talking about providing home care, maybe your family will need to pitch in and help out with some of those costs too.
So you really have to have a good saving strategy.
Right.
Possibly look into long-term care insurance.
Right, and that's actually something people should do before they get to where they need it. In other words, people should be doing it when they're maybe in their 50s or so, and they should be saving even earlier than that. But to look at long-term care insurance, and by the way, there is an aspect of that may be available through the healthcare reform legislation that was passed. It's called the CLASS Act, and it will provide a long-term care insurance. And you have to work a certain number of years and all to be covered, but it is a way to begin to address that issue because there's going to be such a need. It's going to be so large.
Right. So clearly, we have to start thinking about this now, and you can do that on careconscious.com. You can get the information you need and communicate with experts like Dr. Glass. And really appreciate you checking us out today, and we'll see you next time.